want to ask a few questions to the jury, because you have been going through the process of selecting through a broader number of startups, and I'm sure you've learned a few things there. So, Andre, maybe, what trends did you notice by going through this selection process?
I think what jumps off the page on the executive summaries of all the companies, and you really see during their presentations, is that every single company has identified an unmet clinical need and is working very hard to address that need. And 5 or 6 years ago, there were a lot of medical device startups that were just pushing a lab technology or a lab result. And this is not at all the case here. So either the news is getting out that the VCs don't fund entrepreneurs that haven't identified an unmet clinical need, or my second theory, which I favor, is that this is a very impressive group of talented entrepreneurs.
Which is very, very good news. Jurgi, all the startups that we saw on stage are based in Switzerland, Zurich, Geneva, here at EPFL, or not too far away. What are the strengths of Swiss startups in biotech and neuroscience, and what are their weaknesses?
I think the strengths, I agree with Andre, what we could see is a technology. There is a great technology here. And second is that all these guys they have shown, as others do as well, of being able to combine engineering technology with a clinical need. And very early on, I've started working with clinicians, which are, I think, quite advanced in the Swiss ecosystem. And I think leveraging on the knowledge of these clinicians helps to develop faster, better technology.
I have the impression that there's a lot of generic thinking about the Swiss ecosystem being good in certain things and not good enough in other things. And many companies, for example, start here and then move to the United States. How good is the Swiss ecosystem for startups, Claude?
I kind of want to jump on that one because I've had most of my career abroad and came back to Switzerland, and a number of things I would say, 1/4 of the startups here are in Switzerland are in the life science domain, so they don't have to rush out. I think the second thing is we have the highest number of medical technology companies in the world per capita, so Switzerland certainly not so bad. Maybe a fourth thing, I was looking at the VC funding. Again, it's like 60% goes mostly in the pharma biotech, but to life science, this is like definitely 50% more than the rest of Europe. So I think we got a good environment. And the other thing, I'm kind of representing one of the many people who help. It's a good ecosystem with professionals, pharma, all that, helping these startups. So I think we certainly have a foundation. Okay.
Does everybody agree?
Yeah, I mean, to add, with B2B partners, we've been active since 2000 as an venture investor, and we've invested in over 120 companies, also in Switzerland. So we've observed the ecosystem, and I think it's excellent. And if we look around in the auditorium, there, as you said, strong entrepreneurs. They're good, excellent technologies, and comparable to Israel or the US. So I think that's a fantastic basis. We are here at the EPFL, so a strong basis for technology development. We have good investors in Switzerland, and we have representatives of market leaders of the big companies. Okay. So I think the ecosystem is really great here.
I think maybe something that is missing and that is going to be basically built as we grow, I'm as well a young entrepreneur, Andre as well, is that we need more success stories, and we need more experienced people who have already done that. I think in terms of funding, it's largely insufficient. And in the end, what happens most of the time is that the technology is developed in Europe and bought by an American company when it becomes mature, and then marketed a bit everywhere in the world. I think that's a trap where we shouldn't go. And I think that if I was an investor, I think I would definitively consider all those companies today, because I think that for all of them, the challenge is sales and marketing. It's not technology.
Okay, and sorry, I would like to disagree a little bit. I think it's more about transparency. I mean, most of the companies are not visible to foreign investors, for example, because they are looking really at the domestic market, and that's a major threat to my mind. If some companies have got financing from German VCs, from the US VCs, there have been in the last years strong financings in the double-digit million area. So it's not so much a question lack of financing. It's, to my mind, a lack of transparency that in other countries the investors don't know exactly what kind of technology.
Lack of visibility, you say.
Yeah.
Lack of visibility.
And I think at this, even at such an early stage, it's very important to think globally.
Yeah.
You're not only doing a device or a new molecule for your country. You have to think globally in terms of IP, in terms of market potential. And if you start early enough, then you can really make a difference over the long term.
I'd like to step in also in saying that we're right now living times where the environment is changing. Last year we had 300 investors and people interested in funding company at the Biotech Center. We did the opening of the building, and we heard that philanthropists like this were coming. He was here there. I think in terms of success stories, we had Andrea Pfeiffer in the previous session. This is a remarkable success story. In cardiology, we had CoreValve. EndoSense was the biggest exit in medical technology of Europe last year. These are Vitaly Verin, is a friend of mine, lives in the same village, or sorry, is in the hospital in the same village. We got the basis, and this is the main reason we got on that stage and did that competition. I think we need to improve. I think there's a challenge of both philanthropy, a bit more philanthropy. I see a huge issue of funding the early clinical stage. I think our last speaker in the startups really is, looking for a bit of help. But yeah, there's tremendous help. And again, we've got a couple of the companies willing to represent investors from business angel, high net worth of real venture capital. So there's an interest. We don't have the solution for everything, but yeah, you do not need to rush for the US. But you have to see the worldwide market. Sorry for being long, but...
No, there seems to be always this reaction about, we need funding, but I have the impression that funding is kind of not the most relevant thing. I had a discussion with Bill Gross recently from Idea Lab in Pasadena. He's a legend in funding startups in California. And he said he has analyzed 200 startups, half of them very successful, others less, and a few complete disasters. And the top criteria for success actually was timing, coming to the market with the right product at the right time. Second one was the team, and funding was actually the fifth. So how are we doing on timing here?
I agree with you, but I can tell you that funding helps to bring talents as well. So there we have fantastic stories which could really give would say, make people join those teams because they are going potentially to change the world, but that's not sufficient. To be visible, I can tell you now, I know from what we do, you need funding. And so I think the message from the VCs is be a bit more bullish than what you are. What they want is visibility. So you have already great technology, just do more marketing, and I think you will raise funds, and then you will have the talents that join the company.
Jemila, I'm giving you the last word. This room is full of people who are potential funders of startups, students, researchers. Yeah. What's the message for them?
So the funding is one important thing, but let's start from the beginning. You need to come up with two different points of view. One is the novelty. Is your technology innovative enough? What is the competition outside? Because the competition can be tough outside, so you need to be prepared in advance for that. The second thing is, are you really addressing an unmet medical need? Is there a real need for your technology? So if you consider these 2 points, and if you're secured on that, it's already a big step. The other thing I would say, funding is important, but when you start, and especially when you start, you don't need that much funding. You need the right expertise and the right environment of people who will provide you the right path. When I say the right path, the right experimental setting, the few experimental validation you need for your proof of concept, that's one very important thing. And then the market path. You cannot go for 5 different markets usually when you start. You need to really define the one that really makes sense. And it's not necessarily the biggest one, it's the one that is the most straightforward regarding your technology. So yeah, novelty, real differentiation, that's really important, unmet medical need, and then create the best environment as possible around your technology. You don't need $15 million or euros or Swiss franc to start. You need the right people, and then of course it's combined with the sufficient amount of money, but then you can have 15 million Swiss francs and no expertise in your team, and the project will never go anywhere. So that's my message.